Our next topic is an issue that has significantly been brought into the spotlight, and of course that is of educating girls, women and men about women's menstrual health and hygiene. And certainly here in South Africa the access to sanitary pads or lack thereof has become more and more prominent. In light of this, the Department of Women together with the National United Nations Population Fund will co-host the first ever symposium on menstrual health management in East and Southern Africa. But joining us now to take this discussion further is Tlangelani Shilubane, who is the Assistant Representative at the United Nations Population Fund, as well as Shoki Tshabalala, who is the Acting Director General at the Department of Women. Ladies, good morning to you. Thank you so much for coming through.
Thank you, Palisa.
As I said in my introduction that this is a very important issue that we should be talking about, let's just focus a little bit on the state of menstrual health on the African continent.
Okay. I won't dwell so much on the data because there's been a lot of controversy about the numbers that are thrown around. In the African continent, it's mentioned that 1 in 10 girls or women lack access to sanitary hygiene products. And in South Africa, the number was estimated to be around 7 million, and that was disputed and brought down to about 2.5 million. Yeah. But that's not the issue. The issue that we are focusing on is that this is a key health aspect that affect almost every woman and girl who's between the age of 10 and 50. Today, the figure that's been thrown around in social media is 28% of all women require access to this product. So it's an important aspect that we must look at. The main challenge that we're faced with is that it's come into the spotlight now, as you've mentioned that in your introduction. But this is a natural phenomenon that was supposed to be part of our lifestyle, not taboo or influenced by the social norms that it's faced with. And coming from a position where we are, when you take for granted certain things because you are in a position of privilege, we forget that there are those who are underserved. There are those that are coming from poor communities. There are those that do not even have the basic access to an ordinary pad that you and I might take for granted. And that's where we are. We need to take it forward from here.
But I think South Africans and Africans in general, Mam Shoki, are actually hitting the call. They're doing what they can. There are so many campaigns, many organizations that are collecting sanitary towels for the disadvantaged women. How far are we in terms of assisting, but most importantly, the state of that menstrual health here at home, if we bring it home to the South African grounds?
Let me first commend you for affording us an opportunity to take you through our programmatic approach to this matter. The main focus here is from a human rights perspective, particularly the reproductive rights. We've made strides in partnership with the private sector, your UN agencies, your NPO sector. Of course, there's a lot of work that still needs to be done, because the more we reach out to rural communities, the more we realize that the situation is more dire, particularly in relation to not necessarily the provision of the sanitary dignity pack by itself, but issues of infrastructure impacts a great deal on the girl child. The whole issue of how we plan as government, ensuring that there are proper gender indicators, and we ensure that we allocate resources, because that's another issue, for a much more gender responsive approach to this matter, the more we will reach out to many more girls. Right now, our focus is primarily to the school-going kids, the quintile schools 1, 2, 3, but with time we'll begin to focus to government institutions where we can be in a position to afford provision of this product to women who actually need it more than any other woman. But I must say, the partnership is more welcomed, and we would like to strengthen it and work harder with churches, with ordinary government servants or civil servants who can also make a contribution in that regard, but men coming on board, because this is just not an issue that affects women. It's about time that fathers, when they assist in purchasing groceries, that they should note that I have to buy sanitary pads for my wife and for my girl child.
But they must also know the entire menstrual health difficulties that come with going on periods, for example.
It's true, if I may just talk to this matter in a nutshell, it's not only in the home setting where we are concerned, the religious practices, the cultural practices. It does sometimes have its own challenges in terms of harmful practices to the girl child. Just the onset of menarche to some people is a signal of, I'm grown up, I'm a girl, therefore I can be married and all of that. So it's a host of issues that we are addressing in providing this basket of services. But above all is to play that advocacy role and make sure that we create awareness on this area.
All right, and government has been criticized on many occasions to say they're able to provide free condoms, but they're not able to provide free sanitary towels. We've run out of time. I just quickly want to touch on the symposium. Talk to us about the symposium. Who is it aimed at, and who's welcome to participate?
Okay. It is the first of its kind in our region, and we are expecting to have all manner of representation from the highest level, as in ministers from Eastern Southern Africa countries. We're expecting to have representation from the academic sector, civil society, young people themselves, and also men as advocates in part of this agenda. UNFPA, together with Department of Women, have put together a program that will holistically look at how we address this human rights issue to ensure the human dignity of girls and young women, starting from a policy perspective, going into what is the situation in terms of implementation out there, because models differ per country, what has been achieved, and looking at where are we going next, because the ultimate aim is to ensure that we leave no one behind.
It's true.
Therefore, we must take off all limits, limits, period.
We've run out of time, but we'll surely extend an invitation post the symposium. Thank you so much for coming through, and all the best.
Thank you so much for having us.
Many thanks to my guest here. Let's take a quick ad break here on Morning Live. One more item before we say goodbye.